The name of the product is ZEM Life Device, and the product is a smartwatch that can automatically determine if you're at critical risk and how to inject the medication.
We've conceived of it initially with 2 cartridges, and the first use would be to help prevent the reversible narcotic overdose deaths that we're seeing in such massive amounts in this country right now. Same thing with other issues like anaphylaxis. The blood pressure drops out. With someone who has a bradyarrhythmia, a very slow heart rate, the heart rate's too slow to deliver effectively. Someone who has a pulseless electrical arrest, for whatever reason, maybe they've got a pneumothorax, a tension pneumothorax developing from a car accident. They stop delivering blood to the periphery, the heart's still working, it's got electrical activity, but there's no pulse, no blood pressure because of some obstructive process. If someone's bleeding out from hemorrhage, blood pressure's dropping, all of those scenarios, epinephrine delivered, that can save them until the signal has gone out to bring help. For seizures, the drug that people need for seizures to increase the seizure threshold, decrease the likelihood of having a seizure, is a benzodiazepine like Valium. That could be injected IM. There are any number of drugs that can be injected by that method. There are others that aren't critical life-saving things. People right now are injecting drugs like Ozempic. Those are injections that are routinely scheduled, that could be routinely scheduled into the watch. And people who go out hiking in areas of the world where there are snake infestations, many people die from snake bites. There's a synthetic snake antivenom that could be incorporated into the watch so that say you're going to be in those areas, you want that in your watch. There's a company that has a device called a Libre that monitors the glucose levels. It could Bluetooth communicate with that Libre, and then if someone is running too high and they're in danger of ketoacidosis, could inject some insulin for them. If they're running too low and they're in danger of seizing from hypoglycemia, inject glucagon. And then the other things that might be helpful that we might be able to affect, there's so many lives that are lost from heart attacks. 90% of people never make it to the hospital when they have a heart attack. It's either unwitnessed, or even if it's witnessed, people don't necessarily know what to do. They're not able to go get an AED in time, and that's another potential use for it. Maybe it communicates with somebody who has known coronary artery disease and has the implanted automatic internal cardiac defibrillator. Maybe it communicates with that device and tells it if it's not detecting that it needs to shock, that it needs to shock. Or maybe it announces to bystanders, find an AED. There's so many ways that it could shorten the time to treatment. And I'm asking you to join with us so that we can develop this to help save lives.